There are some things in medicine that once you see it, you can never unsee it. And this is a story that's haunted me for a long time after and shook me to my core. This happened back when I was a second-year internal medicine resident. I was at another hospital doing an elective in ICU, and it's one of the days that I'm on call. It's around 6 p.m. The day team is just about to go home, and we got a call for a 55-year-old lady who's on the floor and not doing so well, likely needs ICU for admission and intubation. The story is, she was relatively healthy up until a month ago when she was found a lump in her breast and was found to have metastatic breast cancer. Unfortunately, this had spread almost everywhere, and she started chemotherapy a couple weeks ago. She was admitted to the hospital for the last 2 weeks, though, because she was having some complications of chemotherapy affecting some of her cell lines. And in the last 24 hours, it seems like she had caught a pneumonia that was making her decline overall. So the nurse is telling me the story over the phone. She notes that there's some bleeding noted by the nose, the mouth, and there's some bright red blood per rectum. But hemodynamically, she's stable, and her oxygen levels on the softer side, but with some supplemental oxygen, they're stable for now, though her work of breathing seems to be getting worse. So I immediately tell her to bring the patient down to the ICU. She needs to be intubated and resuscitated further to explore what's happening. The patient's brought down to the ICU immediately, and as we're trying to settle her in, she goes into cardiac arrest. The ICU consultant was still in-house, so she's preparing to intubate the patient, put in a central line, arterial line, as I'm running the code at the head of the bed. As I'm running the cardiac arrest, I go through all the 5 H's and T's of the likely etiologies of cardiac arrest and try to address all of them. Despite this, it's been almost an hour that we're doing ongoing CPR with no signs of return of spontaneous circulation. Ultimately, we ended up continuing the resuscitation for an hour and a half almost, which is unusual for patients who have metastatic cancer. However, her prognosis was deemed to be quite favorable after chemotherapy. Regardless, after all of our valiant efforts, it seems like there was going to be no success. However, this is the moment that stuck with me forever. I was at the foot of the bed. I'm looking at her with people doing chest compressions actively. With each time, you can hear the ribs breaking, multiple ribs broken, bruising on her chest. And mind you, she's still bleeding. So there's blood all over the bed from down below. There's blood coming out of her mouth with each chest compression, blood coming from both sides of the eyes that are red from the nose. And this was the crazy part. Each time someone would press on her chest, more blood would come out of the eyes. And it was quite a horrific sight. And it's still stuck and imprinted on my brain. But sights like these is why most healthcare professionals don't want CPR and don't want those aggressive resuscitations.